In this lecture, we are going to discuss dementia. It is important to understand that dementia is not a disorder, but rather a term used to describe a group of symptoms. The symptoms of dementia involve one's cognitive abilities, such as the ability to think, remember, and reason. There are at least 50 conditions that can cause dementia. The most frequent ones are neurodegenerative diseases such as Parkinson's and Alzheimer's disease. Brain injury can also cause dementia, as can any of a variety of brain infections such as HIV, meningitis, or syphilis. In addition, there are many treatable causes of dementia, such as vitamin B12 deficiency and metabolic imbalances caused by thyroid, liver, or kidney disorders. The onset of dementia is usually very gradual. In the early stages, individuals are generally alert and aware of their surroundings. However, even during the early stages, memory, especially memory for recent events, is affected. Gradually, there is a progressive impairment in the ability to learn new information, to engage in abstract thinking or problem solving, and to control movement. The individual may become disoriented and unable to control their emotions. In cases of some infections, the dementia can be reversed. However, in cases of brain injury or neurodegenerative diseases, the dementia continues to worsen as the disease progresses. The most frequent cause of dementia is Alzheimer's disease, accounting for about 50% of all cases, while strokes are the second leading cause. Alzheimer's disease is a progressive and fatal disorder. Onset is typically after the age of 50, and while age is not the cause of the disorder, advancing age increases the probability of developing the disease. Interestingly, we are seeing a global increase in the prevalence of Alzheimer's, with the greatest number of cases observed in the United States, followed by India and China. As the global population lives longer, it is expected that by the year 2050 there will be 45 million cases worldwide. This will present significant healthcare challenges since in advanced stages a person with Alzheimer's disease is totally dependent on others for their care. Many people think that Alzheimer's disease is primarily a problem with memory, and while it is true that there is a significant and progressive loss of memory, there are also multiple cognitive impairments and a gradual deterioration of mental abilities. The early signs of Alzheimer's involve a loss of memory for recent events. However, as the disease progresses, there is a gradual loss of brain tissue and the development of neurofibrillary tangles and plaques in the brain that interferes with the function of brain cells. With this loss of brain tissue, individuals exhibit significant memory loss, a decreased ability to talk in any meaningful way, poor judgment, and a neglect of personal hygiene. Eventually, there is a loss of contact with reality and a loss of motor control that renders the individual bedridden and reduced to a vegetative state. On average, individuals live about 7 to 10 years after diagnosis. However, there are cases in which people live as few as 3 years after diagnosis. Strokes are the second leading cause of dementia. Strokes are a sudden disruption of the blood supply to the brain. The disruption may involve only a very small area of the brain and produce symptoms that are not immediately noticeable. Larger disruptions that affect more areas of the brain generally cause the most damage and the most severe symptoms, including dementia, loss of speech, paralysis, and death. There are many causes of strokes, and you will learn more about them in the PowerPoint presentation that follows this lecture.